Hello and welcome to today's webinar, What is PrEP and what does it mean for Indigenous people? My name is Darren Ho. I am the Program Manager of the GBMSM Health Network and I'll be your moderator today. To start, I ask that everyone be on mute during the presentation as there will be some opportunities for questions afterwards. Feel free to enter questions into our chat box and our presenter will answer them at the end. Today is my first time hosting this webinar series. However, this is a continuation of last year's series, which took a hiatus as we underwent some staffing changes here at the Community-Based Research Center, or CBRC. CBRC has a number of programs, including the GBMSM Health Network, but also the annual Gay Men's Health Summit and the periodic Sex Now survey, which will launch this spring. For those of you who don't know, the GBMSM Health Network is dedicated to connecting people and organizations in BC who are working to better the health of gay, bisexual, and other men who have sex with men, including trans and two-spirit men. I would like to thank PHSA, the Provincial Health Services Authority, for sponsoring this webinar series and making it possible for CBRC to continue to host knowledge exchange opportunities such as this one. Before I hand things over to our special guest, Harlan Pruden, I'd like to underscore why this work is important to the network and CBRC. Over the past few years, CBRC has made active attempts to engage more two-spirit and Indigenous gay and bi men. We have held intentional dialogues, increased Indigenous content at our annual summit, and partnered with local Indigenous organizations to help us realize our commitments to truth and reconciliation. In PrEP, we missed an opportunity. While we are proud to say that we offered a webinar in early 2017 in which PrEP access for Indigenous men was outlined, the follow-up from that webinar by CBRC and our partner agencies was not sufficient. We want to do better moving forward. So I'm here with our presenter, Harlan Pruden, educator of the Chimamuk Aboriginal Program at BC Centre of Disease Control. Over to you, Harlan.
Comes a responsibility of how do I want to show up. Nome is two, and Mani is a sacred journey. And so I'm in the process of getting that translated over into Cree. And so I identified myself as a member of the Cree Nation. And I also said that I am two-spirit. Niha, I am a Yahweh, and within my own language. So today I'm going to be talking about PrEP. What is PrEP and what does it mean for Indigenous peoples, both here in British Columbia as well as in the rest of Canada? I must acknowledge that I am currently positioned on the traditional and ancestral and unceded territory of the Squamish, Tsleil-Waututh, and the Musqueam First Nations people, Coast Salish nations. And so I would like to honor and acknowledge that I am a guest on their territory. I would also like to thank Community-Based Research Center for Gay Men's Health for hosting this incredible and important conversation around what is PrEP and what does it mean for Indigenous people. As of today, I have no stated conflicts or interests to declare in this conversation. But I would like to add on to this disclosure in that I do sit in relation, and I sit in relation to my First Nations people. And so with that, the disclosure is I have no conflicts. I do have a relationship, and I am beholden to that community. A brief overview of the objectives for today's conversation. For today's conversation and discussion, will be from a First Nations and Inuit people's lens of what is PrEP, who is PrEP for, and accessing publicly funded PrEP here in BC and in the rest of Canada, and then some additional resources to dive in a little deeper. A little bit about Chimamuk, and which is a program of the British Columbia Centre for Disease Control, and Chimamuk is our Aboriginal public health program. And these are my fellow colleagues and team members, Felicia, Jessica, Michael, Lynette, myself, and Amanda Porter. Chimamuk provides innovative and culturally appropriate HIV, hepatitis, and STI education resources, as well as wise practice models for and with Aboriginal communities here in British Columbia. This is accomplished through our following programs: Around the Kitchen Table. And Around the Kitchen Table, we have a network of about 200 women throughout BC that we impart on how to hold conversations. You may know that as facilitations or facilitation skills. And then what we do is we've developed an amazing resources for these women to go back into their communities and to hold conversations around sexual health and sexual well-being, as well as other conversations of like working with Two-Spirit people or anything in which the community wants to discuss when we develop those curriculums. Using that as a model, and Around the Kitchen Table has been around for about 15 years and has broad-based community support. Building upon that is that we developed our men's health program, and that's Encouraging Strong Past. And it's a replication very similar to Around the Kitchen Table, but because we're working with Indigenous men, the program is slightly different because of different conversations, different ways of working and engaging with those community members. We're in the process right now of developing a province-wide Two-Spirit program to increase capacity and leadership within that community. And we also have developed and are always creating community-relevant resources for our community. Chimamuk, and this is the Chimamuk tree, which we developed through our strategic planning process, and we are always updating this on an annual basis. The Chimamuk tree serves as a theoretical understanding, and the various post-its as well as the clouds provide a visual roadmap to guide our work and to make sure that we are, our current workload is grounded within this plan. And so you can see from the deep work and deep structures to the nurturing of programs, and then the actual harvesting that comes up, and the different post-its showing where our various programs and discussions are. And the clouds represent aspirational goals and where do we want to take Chimamuk. And it's also really kind of interesting to note that Chimamuk is Chinook, and Chinook was the language of trade here in British Columbia, in that there are so many different languages, and so many of our traditional folks spoke two different languages. They spoke their own language, and for trade, commerce, as well as governing from nation to nation, everyone would talk in Chinook, and so it became the language of commerce and the language to govern nation-to-nation conversations. So Chimamuk is Chinook, and it translates into new work or new beginnings. So today, we're going to be talking about prevention and around HIV and prevention within Aboriginal communities. Now, I'm not sorry, I use the word Aboriginal, but Aboriginal is inclusive of the Métis community. The Métis community is not going to be included directly within our conversation. So I'll only be talking from a First Nations and Inuit process, and there will be some attentiveness to the Métis community later on in the presentation. So you can see from the toolkit is that it's broken down into two major areas, both medical on the top and the various medical interventions, and then on the lower part is behavioral as well as physical barriers. Now, for HIV prevention, for a comprehensive HIV prevention response, must include multiple approaches instead of just one or two approaches. It has to include what we advocate is 4 different modalities. And the 4 different modalities, according to our medicine wheel and the way that we approach this work as well as conversations, is medicine, medical procedures, and behavioral approaches, as well as physical barriers. Medical devices and medical procedures. There is no one HIV prevention approach that will be acceptable to all. The best option for one person may not be the best for others. And critical to this conversation is research. And to use research so that it is evidence-based in the development and test new prevention options that offer people greater choices when it comes to protecting themselves from HIV, as well as in the treatment and cure of HIV. Now again, going back to the toolkit, we are going to narrowly focus our conversation today on PrEP, and that is pre-exposure prophylaxis. So PrEP is a prevention approach that focuses on people who do not have HIV but are at risk of exposure to HIV through sexual contact and or injection drug use, or IDU. With PrEP, people who are not infected with PrEP receive prescription and take a medication. The medication is a pill taken once a day, and the medication may lower their risk of HIV transmission if they are exposed to HIV, either by choice, by choosing to have condomless sex, or by accident, they've had the condom breaks during intercourse, or if they are injecting drugs and in the needle there is exposure to HIV. And so it is through that this is another viable intervention in the service to reduce the risk of HIV transmission. Now, I want to be clear in which that I'm sure that folks know the difference between N Pep and PrEP. So N Pep is it is a post-exposure, and what we are talking about is a pre-exposure treatment that is used in the service for decreasing the HIV in transmission. So a little bit of history about PrEP. So in 2006, the co-formulation of, and I'm not going to try to pronounce this, the brand name of Truvada received a NOC from Health Canada for the treatment of HIV. So Truvada started off as a treatment and served to treat for treatment and care of HIV. In 2007, Truvada was listed as a non-insured health benefit for the treatment of HIV infections. The non-insured health benefits are eligible to residents in Canada who are either First Nations person who is registered under the Indian Act, or an Inuit recognized by Inuit Land Claim Organization, and an infant who is less than 1 year whose parents is registered as a First Nations person or a recognized Inuit. And again, absent from that conversation is the Métis community. And so if the Métis community was included, then I can use the word Aboriginal. And so I'm going to be flipping back and forth. When we use the word Aboriginal, it is inclusive of First Nations, Inuit, as well as Métis people. And so our conversation at this point is only about First Nations and Inuit people. In BC, the First Nations Health Authority began receiving payment transfers from Health Canada for their non-insured health benefits on July 2nd, 2013. And Truvada was covered since that time as treatment for HIV-1 infections here in BC. But in February 6, 2016, Health Canada issued, again, a notice of compliance for Truvada in combination with safer sex practices for the prevention indication of PrEP to reduce the risk of sexually acquired HIV-1 infections in negative adults. Truvada is just on a very, very basic level is a combination of two antiviral drugs. Truvada is approved for daily use for HIV prevention, and you can see from the last slide that it was approved for HIV prevention. It started off, HIV treatment, and it started off as a treatment. Truvada must be taken consistently on a daily basis to be effective as a pre-exposure prophylaxis. It is recommended that people who are prescribed PrEP be used in combination with other prevention strategies that include behavioral interventions as well as other strategies from the medicine wheel. And you go back to that image of the four-point approach to HIV prevention. How does Truvada work on a very basic level? Truvada, again, is an antiviral medication that protects HIV-negative people from acquiring HIV if they are exposed to the virus. ARVs block the action of a certain protein that HIV needs to infect the body. So if you're exposed to HIV and you have about a 90% compliance, 90% or greater compliance of taking of Truvada and or the generic formulations, is that if you're exposed to HIV, basically it is wiped and voided from your system in very, very layman and broad swathy terms. Who should use Truvada for HIV prevention? Now, this guidance in this next section is basically a synthesis of the British Columbia Center of Excellence HIV guidance documents, as well as the Canadian guidelines of who should be on Truvada. And you can pull up both of those guidance documents if you are a medical service provider and or someone that is working with this community. So for us within the Native community, it is male-assigned two-spirit people and or Native men who are having sex with men. And so they could be gay-identified, bi-identified, or straight-identified. If they are having sex with another man, they are a potential candidate for Truvada. Trans women who are having sex with men, heterosexual couples where one partner is HIV, has HIV, and the other does not, or a serodiscordant couple. And finally, people who inject drugs is the other category. And so these are a synthesis of both of those, a harmonization of both of the documents of who is the priority or target population that should be using PrEP. Accessing Truvada here in BC, as well as in Canada. So a person who is a potential candidate for Truvada, they must be HIV negative and attesting prior to starting use. And it has to be a fourth generation HIV AGAB test. So this cannot be rapid. And again, for the fourth generation HIV AGAB test, it takes 5 to 7 days for that lab work to be done. Other baseline blood work is required. Hepatitis B surface antigen, creatinine levels, as well as an estimated, goodness, pronounce the word, glow. I practiced this the other day and I couldn't say it. Anyway, it is you have to have like a well-functioning kidney and renal functions. And so these are the tests that actually test the renal functions. Now, hepatitis B, if you do have hepatitis B and you do test positive for hepatitis B, it doesn't mean that Truvada cannot be used. There is additional guidance, which is in those two guidance documents for that community, and that Truvada and or its generic equivalents can be still used if you do have hepatitis. And the other thing for requirements for Truvada is that there is ongoing HIV testing every 3 months, and so it's every 90 days when you go in for the refilling of your script. Now, accessing Truvada here in BC as well as in the rest of Canada. So for this next conversation, and this is getting really into the details, and so I would just need everyone's full attention. One is for Inuit people here in BC and in the rest of Canada, the following 3 steps apply. For First Nations that live outside of BC and the rest of Canada, the following 3 steps apply. Right now, we are waiting for guidance from the First Nations Health Authority over their process for coverage as well as access to Truvada and or the generic equivalents here within BC. So there is going to be more to the story, but it'll be primarily for the First Nations people here in BC that may change. Now, for the Inuit people in BC and the rest of Canada, and for First Nations people, I am so happy to announce that publicly funded PrEP is available to Inuit people here in BC and the rest of Canada, and for all First Nations people within Canada, they have access to publicly funded PrEP through the non-insured health benefits. And simply accessing it, on your first appointment, you meet with a prescriber and you say, I would like to have PrEP. And then baseline blood work is ordered. Based on a review of that baseline blood work, and again, we had talked about that in an earlier slide, the 4th generation may take up to 5 days to get those results. Once the prescriber receives those results, then an appointment is set up, a review of that baseline blood work to determine whether or not you are a candidate for Truvada and or its generic equivalent. Then if you're negative, you have good renal functions, then Truvada is prescribed. For First Nations people in Canada, as well as Inuit people in BC and in Canada, you take that prescription and you go to your local pharmacy and you have it filled right there. For First Nations and Inuit people here in BC and in the rest of Canada, and for First Nations, you just present your status card and or your proof of that you're getting coverage through the non-insured health benefits, and with no cost to those 2 community members or groups of communities, they are then given Truvada at no cost. That is huge. Currently, with the conversation that is happening, is that you often hear that publicly funded PrEP is available only in Ontario, limited availability in Quebec, and here in BC as of January 1st, 2018, that it is available. But if you are in Alberta, if you're in Saskatchewan, or if you're in Newfoundland and you're First Nations and you're Inuit, all you have to do is to go to your prescriber, ask and explore and have the conversation for access to PrEP. And again, these 3 steps follow: a baseline blood work, a review of the baseline blood work, and then getting a prescription and taking that prescription to any pharmacy to have it filled, like any other medication. And again, it is unclear for First Nations people here in BC of accessing and who is covering PrEP here in BC. And when we hear and learn more from the First Nations Health Authority, then we will update this section of the PowerPoint. General population, non-Inuit people at this point. I cannot speak right now for the First Nations people because we're still waiting for guidance from the First Nations Health Authority. So for non-Inuit people, general population here in BC, the process is a little bit more complicated, and there's an additional step within accessing PrEP. So at the first appointment, PrEP is requested and baseline blood work is ordered. At your second appointment, when you review your baseline blood work, the prescriber has to complete a form, and the form is it's a pre-authorization form that demonstrates need. And if you go back to those categories of MSM, trans, serodiscordant couple, or injection drug users, is then you have to demonstrate need, fill out the form, the prescriber has to fill out the form, fax or mail the form to the Center of Excellence for HIV here in BC, and it has to be approved, and it may take up to 2 business days. To decrease and to streamline the process, the prescriber at that point will write a prescription, even though approval has not been gained, but they will write a prescription for PrEP. The community member holds on to that prescription, and they usually wait about 5 days, or their guidance is around 5 days. When the prescriber receives the approval from the Center of Excellence, the prescriber will contact the community member and say, you're good to go, you've been approved for PrEP. And then the community member then has to take that script and has to go to St. Paul's Hospital Ambulatory Pharmacy on 1081 Burrard Street here in Vancouver. There is only one place for them to get that prescription filled. They cannot go to their local pharmacy. They must go to St. Paul's on Burrard Street. Now, adding to the complexity is if you live outside of Vancouver, what the prescriber does is goes through the first 2 steps. Then what they do is when they get the approval that the community member can access PrEP, the prescriber then has to contact St. Paul's, get the prescription filled. The prescription then is mailed to or sent to the prescriber, and then the prescriber then contacts the community member, and the community member has to go back to the prescriber to get the prescription dispensed at the office. So again, here in BC, if you are non-Inuit and you're just a general population person, and this also includes the Métis community. This process holds true for the Métis community, that you have to go to your doctor, baseline blood work, review of that. If you live in Vancouver, you have to go to St. Paul's to get your prescription filled. If you live outside of Vancouver, the prescriber contacts, gets the prescription filled. The prescription, the 90-day supply, is mailed to the office, and then you have to go to the office of the prescriber to pick up your prescription. I hope this is clear. So in summary, PrEP is a medical prevention approach for people who do not have HIV, but are at risk of HIV infection. And individuals take a specific medication on a daily basis to reduce their risk of HIV infection if exposed through sexual contact and or intravenous drug use. Here are some additional information. Now, it must be said that except for one resource in which I will point out, is that there is no messaging currently that exists specifically for the Native community around PrEP and access, coverage, and the use of PrEP. So if you go to PrEP Canada, Rethinking HIV Prevention, that Facebook group, it is good general basic information, but again, it is not inclusive of our Native community. PrEP Facts, Rethinking HIV Prevention and Sex, another Facebook page. Again, getting PrEP Facts is that it's not inclusive to the particulars of the First Nations and Inuit people having access and coverage in all of Canada right now. So the news is that PrEP is available in Canada for First Nations and Inuit people, independent of where they live. And I don't think a lot of people know that. Now, BC Centre for Excellence in HIV, if you go to their website, you can provide the guidance document, but again, it is absent of the conversation around access to publicly funded PrEP. And you will read their guidance, and their guidance is that you have to fill out that form. If you are Inuit, you do not have to fill out that form, and you do not have to go to St. Paul's. You can go to any pharmacy. Again, we're still waiting from the First Nations Health Authority over what is their process, and as soon as they identify their process, we will be updating the content of this presentation. Katie, again, has some wonderful resources. Getting Prepped, Prep information website here from the BC Health, from the HIM, Healthcare Initiative for Men. If you go to HIM's website, they actually have a dedicated page for First Nations people here in BC, and that it is available to that community. And so that's the one resource that I know of that is that has resources and communication that is directed to our community. The Sex You Want is another great general information around PrEP, and the U.S. Center for Disease Control is great for more information around PrEP. Also, if you go to our website, the British Columbia Center for Disease Control Smart Sex, there are a couple of blog posts that are targeted for service providers that is inclusive to the Native community, for the Inuit, as well as the First Nations community. Now what I would like to do is to create a little space for questions, and I would like to thank you all for devoting this time to talk about this, one, incredible news, and two, for the dedicated time to talk about the Inuit First Nations community having access to publicly funded PrEP. What is so unique about this, and I would like to thank Darren as well as CRBC, in that their commitment to drill down and to have a meaningful conversation around the First Nations and Inuit communities here in BC, and that it is a slightly different conversation, but there is an attentiveness because we have different processes. And what I find is that going back to February 6, 2016, when PrEP became available for all First Nations people, as well as Inuit people, through Health Canada, through NIHB, the non-insured health benefits, is that our community had available, was the first to have access and coverage to publicly funded PrEP. Yet, if you go back, and you can go, and I've been looking, is that there has been no concerted effort to notify our community that we have access and coverage to publicly funded PrEP here in Canada. And I just find that this conversation around PrEP has showed and exposed gaps within the conversation around PrEP for our community. And so for CRBC's commitment for not only this webinar, but for other organizations like him to step up and to say we should do a better job of targeting our messaging to the Native community and embodying and operationalizing a lens of reconciliation and making right, I think is commendable. And I also, as an advocate, I could be incredibly highly critical, but right now, the point is that we must work to get this message out. You know, like in Saskatchewan, HIV in the First Nations community is 400% higher than non-Native people within Saskatchewan. Yet, those individuals within Saskatchewan who are First Nations and Inuit have access to PrEP. But where is the messaging? Where is the conversations for Saskatchewan First Nations people of saying here is a viable intervention that is evidence-based and shown to be highly effective to greatly reduce the transmission of HIV within this community? And there, I think, is we cannot dwell in a problem. Is that we must look forward to increase this conversation within our community. So with that, I welcome all of your questions, and Darren is going to help moderate that session.
Thank you, Harlan, for that very insightful presentation. So as Harlan was saying, we are going to be taking questions, and we're taking questions both through audio and also through our chat box. So you can send the question directly to me, the host, or to Harlan via the chat box or the Q&A box, because we'll be monitoring both, or you can unmute yourself and ask your question directly. So as we are waiting for all of the questions to arrive, Harlan, one of the things that I'm interested in knowing is what have you perceived as being the barriers for guys who know about PrEP, for First Nations and Inuit guys who know about PrEP and want to access PrEP, but maybe can't get PrEP? What are some of the barriers there?
So the biggest barrier I find is that the community doesn't know that PrEP is available. One, they don't know what PrEP is. They don't know that it exists. And they do not know, for First Nations as well as Inuit people, that it is covered and publicly funded. So I think there has been no concerted effort. So I was in Haida Gwaii on Thursday and Friday last week, and we attended their men's health group, and 19 First Nations men showed up, and I shared with them PrEP, and they were like, we want information. At Encouraging Strong Paths, our November retreat through Chimamuk, 16 Aboriginal men, and when they heard about PrEP, they were like, we want this information. And so I've been working, and we've been funneling information to people. It's like saying it is available. So again, I think that we have missed an opportunity, and we're already like lagging from February 6, 2016, when this announcement was made. It should have been sung from the highest levels, and yet there has been no messaging that has been targeting of saying First Nations and Inuit people have access to PrEP.
Thanks, Harlan. I have a question from Sam Pattern, who wants to know, to what extent do you feel like Indigenous people would be willing or interested in a daily pill for HIV prevention?
Again, from the two examples, from me just being in Haida Gwaii and the men saying, wow, we want more information around this, right? To the 16 men that came to Encouraging Strong Paths, as well as any time that I am with the community member and communities, is I let them know, and there is great interest in what is PrEP and that it is a viable option. And I think, like, I don't know whether or not, I cannot answer that question of whether or not that there is interest, because there is like such knowledge, there's such a gap within knowledge. So it is, we have to create spaces so that we can disseminate this information, and we can leave it up to the community of seeing whether or not that this is, whether or not that there is an interest. But, you know, like for community members, is you don't know what you don't know. And so when given the opportunity, they then can, it becomes a viable option and a viable intervention that they may choose to use. So again, if you walk into a community and say, hey, what is PrEP? No one's going to know what PrEP is. So you have to take that moment to disseminate the information so that they then can explore the possibility of whether or not they want to go down this path of using this tool in service of the prevention of the transmission of HIV.
Great. So Robert Alsbury wants to know, can you repeat the last statistic that was reported, the HIV rate being 400 times is higher in what community in comparison to?
Sure. So all you can do is, I'm going on press accounts, and if you just type in HIV in Saskatchewan, there are some great press accounts around Saskatchewan, and that the rates are, I believe, and I have to, like, again, do not directly quote me, just going on, because it's, again, my attentiveness has been here in BC, so I just was like skimming, but it is First Nations communities in BC compared to non-First Nations communities, First Nations communities in Saskatchewan compared to non-First Nations communities in Saskatchewan. It is only within Saskatchewan. And so the rates are skyrocketing. And again, the numbers are a little wild because I remember earlier on, probably about like 18 months ago, it was 200%. And then not that long ago, I saw another press story of 400%. And so again, it is a big problem.
Great. Jonathan Digglehart has this message for us. I have found the few interactions I have had with First Nations MSM in rural communities here on the island that they were aware of PrEP being free, but felt way too much stigma trying to access it simply because, as one MSM said, my aunt is the only nurse up here, and I can't risk asking her or my family will know. Are there any plans in place to help MSM access PrEP in these smaller communities where they are not comfortable seeking any sexual health care due to the nature of their communities?
Sure. So first of all, is you can go to any prescriber. For First Nations people, is you can go to a walk-in clinic and again have that baseline blood work, get your prescription, and if you, after a review of the baseline blood work, you can go to any pharmacy. I do know that I've been working with an individual, a healthcare provider. I don't know whether or not that they're a prescriber, but they were in Nanaimo. And the healthcare prescriber had reached out to me and said, I have an individual who is a male-assigned native MSMer, and they heard that if they request Truvada, that the band receives some sort of notification that they have a band member that's accessing Truvada. So again, I reached out to the First Nations Health Authority, and the First Nations Health Authority is saying that no medical information is shared with the band. So the individual then went to a prescriber, requested Truvada, baseline blood work, review of the blood work, and then took that prescription to the pharmacy. The pharmacy then dispensed it and then billed the First Nations Health Authority, and that is the only chain of information. So I think that we have to work to dispel this myth and dispel this this misinformation within the community. But again, that only works by engaging with the community and not fueling and or working to properly address the reality of what is the actual access and coverage of PrEP. So again, we have to work to dispense this information, and that it is like any prescription. Like if you're diabetic, the only person that should know that you're a diabetic is your prescriber, the pharmacist, and you. If you're accessing PrEP, who should know? Your prescriber, the pharmacist, and you. And it is like any other medication.
Yeah, that's a great point, Harlan. Kyle Dick here says, thank you for the great presentation. My question is, why is PrEP not being issued to be distributed in and all pharmacies in BC for people who live in and outside of Vancouver? The time it takes for people who live outside of Vancouver to access PrEP seems to be much longer than those who live in Vancouver.
That is a great question, and that is something that should be taken up with the Center of Excellence for HIV here in BC, who have set that policy. But again, if you're Inuit and you live here in BC, you do not have to go for that. You don't have to get that form filled out. You can get a prescription and you can go to any pharmacist. And prior to the January 1st announcement for the expansion of PrEP here in BC, if you were First Nations, that was the process. Now, we're still waiting to hear from First Nations Health Authority what is their process for accessing PrEP for First Nations people here in BC in a post-January 28th announcement. So we're unclear about that right now. So again, more guidance is needed and more information is needed for BC's First Nations people.
Great. And I think I missed this question here from Robert Alsbury, who asked, as a non-First Nations person living in Ottawa, Ontario, any suggestions to help get this information out?
Sure. One is using this as a model for webinars, getting First Nations people engaged. And I know that in Ottawa, which is Ontario, which does have universal access to PrEP as one province, is that they're just, for any conversation around PrEP, there should be a carve out for the First Nations community. So I know that I went through and I was like reading and looking at the process for Ontario, and the guidance that I received was just general guidance. I don't know whether or not that guidance on getting your prescription filled, whether or not that applies for First Nations people who live in Ontario. But again, it is irrespective of that, is getting clarity on the guidance. But secondly, is getting the message, a targeted message out to First Nations people. And so webinars like this that are specifically for First Nations and Inuit people, and from that lens, is greatly needed. All of the resources and everything that I have seen, you would think that we don't exist. And in essence, we don't exist because there is no messaging for our community. And I think that, again, that opens up this conversation in which that there is not only an erasure, but it exposes a huge gap within our healthcare systems that we are not included in a meaningful way. Now, and so I think that, Robert, is either if you're First Nations or non-First Nations, if you're not First Nations, is to embody a sense of allyship. Is don't speak for us, but create spaces for us to speak for us ourselves. And if you are First Nations, is to find your voice and to speak up and to hold spaces like this that are devoted to First Nations and Inuit people around this issue and any other issue around.
Great. I just have a reminder from Sarah Chown, who says it might be good for folks to know that all doctors can call the BCCFE for providing help if needed. The BC Center for Excellence has information that we can give to our healthcare provider here, or we can ask them to call the center's pharmacy support line, which is Monday to Friday, 8 a.m. to 5 p.m. at 1-888-511-6222. Doctors in Canada can prescribe PrEP, but not all doctors may have experience in doing so. So finding a doctor can be challenging. And if you want help in finding someone, then you can let them know, and we might be able to help. And so all of this information is also on the YouthCo site, youthco.org/PrEP. Amy M. asks, I'm wondering if there are side effects to PrEP which may affect adherence, and what is the efficacy of PrEP?
Sure. So again, at any one of those resources that I listed here, there are efficacy statements, and so I'm not going to drill down into the numbers, but it is a highly effective intervention if folks use and take the drug on a daily basis. What was it? Efficacy? Oh, side effects. There are some limited side effects. Most notably that I've seen from the literature is gas. Where if you are a male anal receptive partner, you don't want to have gas, right? But usually what they have shown is that it's a stabilization period, and that side effect does go away. There are a couple of other side effects, but you can read, like Katie has a wonderful resource on this potential side effects. But again, there are side effects from taking aspirin, yet we still take aspirin. So this is, again, is that PrEP is not going to be a panacea. Again, if we go back to that medicine wheel, HIV prevention has to be a multimodality approach. We cannot put all of our eggs in one basket of saying, I'm only going to take Truvada and I'm good to go. There's behavioral, medical, medicines like Truvada, and then there are physical barriers like condoms. and that we must take a multimodality approach in the prevention of the transmission of HIV.
So I have a message here from Dr. McDonald at FNHA. Can we clarify that while we are looking at improving the process, that no First Nations person will be denied access to PrEP?
Correct. So in a independent of January 1st's announcement that PrEP is universally available here in BC, that First Nations people still have access to publicly funded PrEP. The guidance that we're looking for is it's merely a process question. Whether or not First Nations people have to fill out that form and whether or not they only have to go get their prescription filled at St. Paul's ambulatory pharmacy, or whether or not First Nations people can go to their local pharmacy. That is the thing. But irrespective of whether or not what the process is, PrEP is available for First Nations people here. We just don't know where they're going to get the prescription filled and whether or not they have to go through that pre-approval form that is mailed to the Center of Excellence on HIV. For Inuit people here in BC, they can go to any pharmacy and they do not have to fill out that form. The prescriber does not have to get pre-authorization and approval. Inuit people can just get the prescription and go to their pharmacy.
Great, thank you. Are there any last comments or questions? So Jody wants to just remind everyone that this webinar is being recorded and is available for people to distribute. So that is one way of getting this word out, no matter where you are in Canada. And I'm seeing that there might be no more questions, so I would just like to give another thank you to Harlan Pruden for the wonderful presentation that he gave us today on what is PrEP and what does it mean for Indigenous people. And thank you to all of you for joining this webinar series, and I'll see you again soon.